So we're going to talk a little bit about, priority, because a lot of persons are struggling with that when it comes on to answering the question. When you think of NCLEX most of the time will ask you question, which action is priority? And if you don't understand that, then you're not going to be able to answer the question appropriately. But when you're thinking about the priority, don't think of it as being, what you could do or the nicest answer. Think of it as, what is the number one thing that you need to do that will save this patient's life, that will not harm the patient? So NCLEX basically uses different framework to help with guiding your choice or your decision. We know about airway breathing and circulation. Anything that threatens airway or oxygenation usually comes first. And that is it, regardless of what is going on. Then you can also look at your Maslow's hierarchy of physiological needs. So anything to do with, comfort, teaching, those always come after you look at blood flow, fluids and all. Then you can also look at acute versus chronic. Anything that is stable versus unstable. You choose the ones that are requiring immediate attention. Actual problems before your potential problems. Treat whatever it is that is happening now. Don't think about what will happen later. Go ahead and treat what is happening now, and then from there you'll be able to choose that priority question. Safety first is always the answer. Anything that addresses safety, preventing deterioration, death, or further injury is basically the answer when it comes on to prioritization. So what keeps the patient safe is what you're always going to be thinking when you're asking, when you're reading through the question. So if they say, okay, then you have a patient that is hypoglycemic, how are you going to be managing, or what is the priority for that patient? The priority is that you need to correct the hypoglycemia with some glucose or some dextrose. So that is the priority action for the nurse. I do hope that this helps. I will go ahead and post additional content related to, nursing NCLEX. So you can always have it at your fingertip. And just in case you have anything specific you want to ask, go ahead and DM me. All right. Until then, I will see you in the next video. Bye.